Bismillahirrahmanirrahim. Dear students, welcome you all to the Industrial Formulation Lab. Today is our practical number 5, that is entitled as preparation of hand sanitizer. As you know, in the current situation, the demand of the hand sanitizer is increasing day by day, and the Drug Regulatory Authority of Pakistan, that is WEB, also approved the formulation to the local pharmaceutical industries countrywide to prepare the hand sanitizer to overcome the need of the people and the life. But in life, preparation of hand sanitizer. The main objective of this practical is to learn about the hand sanitizer, its formula, and according to the two formula provided by the WHO, practical performance of the preparation, that how we will prepare the hand sanitizer and the uses of hand sanitizer. Dear students, after the completion of this lecture, you will be know about the hand sanitizer, that basically what is hand sanitizer and what is formula, and how we will practically prepare the hand sanitizer using the procedure and uses of the hand sanitizer. Hand sanitizer is a liquid or gel like formulation that is used in general to decrease the infectious agents or infectious diseases or microbe growth on the hands. There are different formulations, but WHO, that is the World Health Organization, recommended two formulations. One is alcohol based formulation and the second one is isopropyl alcohol, that is rubbing alcohol formulation. But formulations of the alcohol based type are preferable to hand washing with soap and water in most situations in the healthcare setting, in the hospitals, in the clinics. The preferable one is alcohol based type formulation. Types of hand sanitizer formulation. There are two main types of formulation. The first one is isopropyl alcohol based hand sanitizer, and the second one, that is ethanol based hand sanitizer. Isopropyl alcohol, in short we say that is IPA based. It is IPA stand for isopropyl alcohol. We will need different equipments and different chemicals while preparing this formulation. Among these, graduated cylinder, that I have already told you that whenever we are interested to take the volume, the accurate and precise volume can be taken using the graduated cylinder rather than the beaker, and beaker for mixing and combination. isopropyl alcohol, that is IPA, glycerol, hydrogen peroxide, and container in which it is to be mixed are kept as a final container from which we can make the smaller quantity, that is to be transferred to the bottles that are smaller in nature, and sterile distilled or boiled cold water. These are the requirements we need for the formulation of hand sanitizer. Look at the first one, that is isopropyl alcohol is there, but in case of ethanol based preparation, the isopropyl alcohol will be substituted with the ethanol. If we are interested to prepare ethanol based hand sanitizer formulation, then there is no need of the isopropyl alcohol or IPA. The rest of ingredients are same, only we have to take isopropyl alcohol, that is IPA, if we are interested to prepare IPA based or isopropyl alcohol based hand sanitizer. In case of ethanol based hand sanitizer formulation, we will take ethanol instead of the IPA. There are two formulas. First one is, that is formula for 1 liter isopropyl alcohol, that is IPA based hand sanitizer. To make 1000 ml, you can see in the table different ingredients. The first one is IPA, that is isopropyl alcohol, that is 99.8% pure, and hydrogen peroxide 30% purity, and glycerol is 98%. And the last one, that is sterile distilled or boiled cold water. And on the right side you can see the quantity in the ml or milliliter. The first one we need to make the 1000 ml 751.5 ml. The second ingredient, that is hydrogen peroxide 3%, we will require in the 1 liter formulation of the hand sanitizer 41.7 ml. Glycerol we will need for 14.5 ml. And the last one, that is distilled water or boiled cold water, you have to 192.3 ml of the sterile distilled or boiled cold water. That is the formulation of the hand sanitizer, that is isopropyl alcohol based, or in short we can say IPA based hand sanitizer. The second formulation, that is ethanol based, and this particular formulation, which is termed as ethanol based, we need ethanol 96%, or ethanol we also named as ethyl alcohol, instead of the IPA, that is isopropyl alcohol. Just we have to substitute isopropyl alcohol with the ethanol, and the quantity required is also different, that is 833.3 ml is required quantity of ethanol to make the 1 liter. 1 liter means 100, not 100, 1000 milliliter of the 1 liter is equal to 1000 milliliter of the formulation. You can see the first one here, IPA, that is 751.5, and the sterile distilled water, that is 192.3 in the formula 1, while the remaining hydrogen peroxide, that is 41.7, and glycerol, that is 14.5. In the second formula, the first one 41.7 hydrogen peroxide in the first formula, and glycerol is 14.5 in the second formulation, that is ethanol based. These two chemicals or ingredients are similar quantity. The difference is there, IPA After IPA you can easily calculate it. If you have the idea of this 751.5, that is IPA, and remaining two are constant in both formula. These are similar quantity, that is hydrogen peroxide and glycerol, the similar quantity. If we have these three ingredients, that is 751.5 and 41.7 and 14.5, add these three and subtract it from the 1000 ml, you will get the last one, that is the sterile distilled water or the boiled cold water. Similarly, in ethanol, if we have, remember the ethanol quantity, that is at 33.3 ml, and the rest of two, that is hydrogen peroxide and glycerol, these are similar as in the formula 1, that is 41.7 and 14.5 respectively. Add these three ingredients in the top and subtract from 1000, you will get 110.5, that is the required quantity we need for the formulation, that is of the sterile distilled or boiled cold water. How we will perform this practical? The alcohol, either the ethanol or the isopropyl alcohol, for the chosen or selected formulation, is poured into the large bottle or tank up to the graduated mark. First of all, we will take the alcohol, either the IPA, that is isopropyl alcohol, or ethanol, that is also termed as ethyl alcohol. And the second step, hydrogen peroxide is added using the measuring cylinder. Remember that the formula, that is for the formulation, that is 1 liter, we can enlarge or we can reduce the formula. If we are interested to take 500 ml, we will divide the 1000 ml by 2, we will get 500 ml, and all the ingredients will be divided by 2. If we are interested to prepare the 5 liter, we will multiply the factor by 5, 1 liter 5 times, and then the rest of the ingredients in the formula will be also multiplied by 5 to get the 5 liter hand sanitizer formulation. It is easy to enlarge or to reduce the formula. If we are interested to reduce the formula, we will divide by the factor. If we are interested to enlarge the formula to make formulation quantity more, then we will multiply in this case by the factor, which is the different factor for the formulation. In the second step, hydrogen peroxide is added using the measuring cylinder or graduated cylinder. And the third step, glycerol is added using a measuring cylinder, as the glycerol, that is very viscous and sticks to the walls of the measuring cylinder. So in this case, it can be rinsed with some sterile distilled or cold boiled water to be added, and then emptied into the final container or bottle or tank. We will add this water along with the walls to rinse the glycerol quantity, because glycerol is viscous one, is very viscous, and due to its viscosity it will stick with the walls of the measuring cylinder or graduated cylinder. In this case, rinsing will be necessary to transfer all the glycerol to the final bottle or the tank. 3 steps are there. The first 3 steps, selected alcohol and the graduated cylinder. Then we will take hydrogen peroxide and glycerol, but remember that glycerol will be also rinsed with the water, that is either sterile distilled water or cold boiled water, because glycerol is very viscous. After that, the fourth step is the bottle tank the bottle or the tank, that is the final container, is then topped up to the corresponding mark of the volume, that is 1 liter, to be prepared with the remainder of the distilled water. In the previous step, we have also rinsed some quantity of water, that is in the formula we required that quantity. From that quantity we will take some quantity of water, and rinsing of the glycerol will be performed because of the very viscous nature of the glycerol to be transferred safely and all the quantity safely. The next step is the lid or the screw cap is placed on the bottle or tank immediately after mixing to prevent evaporation. In this step, the lid or the screw or the stopper will be immediately placed on the container or tank in order to avoid the evaporation, because the preparation may be evaporated, and the solution is mixed by gentle shaking the recipient where appropriate, that is small quantity, or by using a wooden or plastic or metallic paddle. We can shake it gently if the quantity is small, or if the quantity is large, we can use a wooden pedal or maybe plastic pedal or maybe metallic pedal. After that mixing, the solution is immediately divided into smaller containers. For example, we are desirous to make 100 ml each bottle, then we will transfer it to the 100 ml bottle. If we are desirous to make it 50 ml bottle, plastic bottles will be there, and we will transfer immediately into the divided container from the final or stock container. Remember that the bottle, after immediately transfer, the bottle should be kept in quarantine for 72 hours. This allows time for any spore present in the alcohol or the new or reused bottle to be eliminated by hydrogen peroxide. Why we kept it in the quarantine? Quarantine is an area in the pharmaceutical industry or manufacturing units in which the finished goods are kept, and after some time they are marketed or transferred to the relevant areas, and 72 hours keeping is done in order to ensure the elimination of any type of spores that is already available in the alcohol or in the bottles, and it should be eliminated by the hydrogen peroxide. What will be the precautions in this practical? Precautions are there. The first precaution we should perform to take care, that is to make the hand sanitizer in a clean space. If the space is not clean, the area where we are going to manufacture the hand sanitizer, it is not clean, then the contamination may be occurred. The second precaution, that mix all the ingredients thoroughly until they are well blended or well mixed. Mixing uniformly is essential for the formulation. And the third one is wash your hands thoroughly before making the hand sanitizer. If you are preparing the hand sanitizer, you should clean your hand, wash your hand thoroughly before making the hand sanitizer. These are the precautions that is to be exercised prior to the formulation or during the formulation. After the formulation and after the stocking in the quarantine up to 72 hours, and to the relevant container, whatever the 100 ml or 50 ml container, we should label in accordance with the national guidelines according to the Drug Regulatory Authority of Pakistan, that is DRAP, or any Ministry of Health related guidelines should be followed. During labeling, label should include the following. For example, name of the organization or institution or pharmaceuticals, date of production, and batch number. Batch number is mandatory, but batch is actually the cycle in which we are preparing. Suppose we say that it is batch 1 of the formulation. In one cycle, the product or formulation we prepare is batch, is called batch, and it is separately given allotted the number, that is batch number. Composition we should mention on the label is ethanol or isopropanol, that is isopropyl alcohol, also termed as isopropyl alcohol, glycerol, and hydrogen peroxide. Percent weight, volume by volume can be also indicated, that how much quantity, how much percentage we have used on the in the formulation. Along with the some other statements, that is WHO recommended hand rub formulation or hand sanitizer for external use only. Avoid contacts with oils. Keep out of reach of children. This information should be also on the label, as well as the usage should be mentioned on the label, that apply a palmful of alcohol based hand rub and cover all surfaces of the hand. Rub hand until dry. That how to use, it is also mandatory for the formulation to be on the label. And flammable should be also on the label, that keep away from the flame and heat. If you are going to use this one, this instruction should be also on the label, that in case of using this one hand sanitizer, you should keep away from the flame and heat to avoid ignition or fire. Next is the role of ingredients. We have used different ingredients in the formulation of hand sanitizer. The first ingredient, that is alcohol. The major component of alcohol based formulation is, of course, alcohol. The mostly used is either 96% ethanol or 99.8% isopropyl alcohol. Both are alcohol, but one is ethanol, that is ethyl alcohol. The second one is isopropyl alcohol. Isopropanol is also another name of the IPA or isopropyl alcohol. Of these, the easily available one is isopropyl alcohol, otherwise known as rubbing alcohol. Please don't use other types of alcohol like methanol, butanol, or others, since they are toxic. There are other types of alcohol available, but we will not use this alcohol because of the toxicity. And the ethanol and isopropyl alcohol, that is IPA, these are not toxic, and we will prefer to use these. The second ingredient we will use, that is termed as humectant or emollient. Humectant are moisturizer that will help to prevent the drying of the skin. For WHO formulation, that is World Health Organization, and WHO recommends one formulation that is miscible in water and alcohol, is non-toxic or hypoallergenic, that is not responsible for the allergic reaction. A popular humectant that meets all these requirements, that is miscible in water and alcohol, and that is non-toxic, and that is hypoallergenic. These requirements are fulfilled by the 98% glycerol. So emollient use will be glycerol because of the WHO recommendation and WHO criteria. That's one is miscible with water and alcohol, and the second one is non-toxic nature, and the third condition is it should be hypoallergenic, and these requirements are met by the 98% glycerol. We can also use other humectants such as aloe vera gel. Aloe vera gel may be also used as humectant, but WHO recommends the miscibility with water and alcohol and two other characteristic properties, that is non-toxicity and hypoallergenic nature of the glycerol. So glycerol is used as emollient. Disinfectant, that is another one. An effective disinfectant is added to this formulation to eliminate contaminating falls. An efficient choice is hydrogen peroxide. It is a good and efficient disinfectant. It is also a mild antiseptic and an oxidizer. The concentration of hydrogen peroxide should not exceed the recommended amount that is already mentioned in the formula, that is the WHO recommended concentration. If we exceed the amount, then it will become toxic or may be avoided. The last one is the uses of hand sanitizer. Hand sanitizers are widely used in the current situation of the COVID-19 to decrease the infectious disease or infectious agents on the skin, hands, and hand sanitizer contain ethyl alcohol, isopropyl alcohol to kill bacteria and viruses on your hands. Another application is alcohol have long been used and known and popular to kill germs by denaturing the protective outer proteins of microbes and dissolving their membranes. Hence, it is preferred to kill the germs by denaturing their proteinaceous protective outer coating, and that's why the hand sanitizers are used. That's all about the hand sanitizer. Thank you all for your attention, and we will discuss this preparation, that's practical, on online Google Meet session. Thank you all.